Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about piles. Nobody likes to talk about bleeding, especially from their private parts, and even most of them would have self-diagnosed it as piles. They don't like to say, when I went to the toilet, I turned around and looked and there was blood in the toilet bowl. So they go around telling the doctor, I have piles. But everything that bleeds is not piles. First of all, you have to see the color of the blood. If it is fresh red blood, then it is likely to be from the rectum or anus. If the blood is maroon in color, then it is likely to have come from higher up in the intestine. And if it is black and produces a tarry stool, then it is likely to have come from the stomach. Also, piles are usually painless unless they are infected or thrombosed. The person himself can put a mirror and look, and the piles may be visible like a cluster of grapes at the anus. This is if they are external piles. Internal piles cannot be seen and they will just bleed. Now sometimes passing motion is very painful and then there are streaks of blood. This happens when a hard motion has produced a tear in the anal mucosa and there is a fissure. Sometimes the bleeding may be due to some intestinal causes like an infection in the intestine with bacteria like Shigella or amoeba, but usually when there is bleeding because of this, there is abdominal pain and fever as well. It may be due to IBS, where the bowel gets inflamed and produce bleeding, and this diagnosis is not piles. Once you have bleeding from the rectum, please take it very seriously. Don't self-diagnose and go to a quack and say, I have piles and please treat me. Please go to a doctor and they will examine you. If external piles can be seen very clearly, otherwise they may put a tube into your rectum to see from where the bleeding is coming. This may be a short tube called a proctoscope or a long colonoscope through which they can see way up into the intestine as well. They may see internal piles. They may see polyps, which are little clusters which occur in the intestine. They may see diverticula, or there may even be a cancer of the colon. Now, once a diagnosis has been made, the treatment has to be proceeded with. But if it is really piles, then you can do a lot of self-treatment at home. Take a plastic basin and fill it with warm water and then put a teaspoon of salt into it. Sit in this hot water for 10 minutes in the morning, afternoon and evening. It will soothe the inflammation and reduce the piles. Before and after passing motion, you can apply ointment, which is a local anesthetic, and that will numb the area so you're able to pass motion without pain. This works for fissures also. Guard against constipation by eating 4 to 6 helpings of vegetables or fruits daily. You can also take Ipsagol husk. This is a non-absorbed fiber, 2 teaspoons in the morning and 2 teaspoons at night, dissolved in a tumbler of water. Remember to drink it immediately, because if you keep it, it will become like a jelly. But please don't self-diagnose and continue with this treatment. Consult a doctor and find out what is causing the bleeding. If it is piles and they do not resolve with these simple measures, then you can opt for surgery. There is simple surgery. The piles can just be tied off. They can use laser, they can use cryotherapy, or if it is a really bad case of piles, they may need to do surgery as well. But remember to listen to your doctor and follow his instructions. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard and found it useful, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.